Bismillah ar-Rahman ar-Rahim. This lecture is for the first grade AL-IRAQIA University Medical College. We talked previously about the bones and the skeletal system. Today we will try to illustrate what is the meaning of a joint. We all know that the bones meet with each other to form articulating points, which are called the joints. They are where two bones will meet with each other. And we all know its importance with movement. Yani we cannot move any part in our body very easily without the presence of the joints. If we, for example, cast our knee or our finger, there will be a great degree of limitation of movement. And sometimes we even can be paralyzed if the joints are not present. The joints are classified in our body into two main classifications. I have a structural classification and a functional classification. Structural, I mean it's from what it is formed of, يعني الهيئة مالتها, while the functional الوظيفي. The structural classification, whether or not there is a cavity between the two articulating bones, which is called the synovial cavity, if it is present or not, and also the type of tissue that connects these two articulating bones. So the structural classification depends on the presence of a synovial cavity and on the type of connective tissue connecting these two bonds. It will be subdivided, this is structural classification, into three types: fibrous, cartilaginous, and synovial joints. أنطيك غشوشة مال امتحان. Most of the joints in our body, الأغلبية من المفاصل الموجودة بجسمنا is of a synovial type. Synovial joint is most of the joints in our body. I have a fibrous and cartilaginous. We will come to each one of them and we will try to give a brief discussion about it. The fibrous and cartilaginous, both of them has no cavity in between the bones, while the synovial has a cavity. هذا فرق number one. Number two, the fibrous joint, the connective tissue between the bones is of fibrous type. الفايبرس دائما معروف عنه انه يكون قوي, tough. The cartilaginous joints, the type of fibers connection is of cartilage, القرقطة. Okay, and as we mentioned that there is no synovial cavity. The synovial joints means that there is a cavity in between and we will come to discuss it by its own. يعني راح أطلع لك بعدين صورة أشرح لك شنو synovial joint ومن ايش متكونة. مثل ما قلنا أغلبية joints in our body is of a synovial type, فلازم نتعرف عليه أكثر. The functional classification, التقسيم الوظيفي للjoints الموجودة is according to the degree of movement. يعني إيش قد مسموح للحركة في هذا الجوينت، فقسموها على هذا الأساس into three types: synarthrosis, amphiarthrosis and diarthrosis. أيضا أنطيك غشوشة مال امتحان وكاتبة النوت اللي جوا إنه all the synovial joints are diarthrosis. أوكي، بقية الجوينتات تتقسم ما بين تكون syn and amphi. Syn, I mean that there is no movement. It allows no movement at all. احنا اكو نقاط التقاء بالجسم بين العظمتين لازم يكون بيها ماكو اي حركة. مثلا for example لقاء السن بالجو بالفك، الاسنان لازم ما تكون حركة. مثلا عظام السكال، عظام الجمجمة من تلتقي مع بعضها أيضا لازم تكون ماكو, allow no movement between them. هذه for example. لكن ال diarthrosis means it allows free movement of the joint, and these are usually the joints which are used for movement. ال amphiarthrosis اللي هو in between السن والداي allow slight movement لكن تكون محددة. نيجي for each one of them. يعني نيجي على أنواع الفايبرس joint. قلنا الفايبرس joint has no cavity and the connective tissue connecting is fibrous type. For example, I have the sutures. suture هو الاسم اللي يطلق فقط على العظام مال الجمجمة. يعني عظام الجمجمة تتميز بأنه التقائها بمفاصل اسمها suture. من أقول اسم suture I'm talking about the joints of the skull. نقطة رأس سطر. من نيجي عليها has no cavity in between, fibrous connective tissue in between, and functionally it is synarthrosis. It allows no movement. طبعا أسماء السوتشرات coronal and sagittal is not for you, it's for the second grade. ما يحتاج تحفظها، بس تحفظ لي suture is a fibrous type and the functional classification of it is synarthrosis. The other type of fibrous joint is syndesmosis. The syndesmosis is the interosseous membrane. كنا نعرف وانت درست هسه البونز والmuscles. You all know where is the interosseous membrane. It is the middle joint in between the radius and ulna in the upper limb, tibia and fibula in the lower limb. So the interosseous membrane, هذا الممبرين اللي يربط ما بين العظمتين, represents a joint which is the middle radio-ulnar joint. It is of fibrous type. It has no cavity. The connective tissue is of fibrous, and it نيجي على movement of it. It is amphiarthrosis, يعني allows slight movement. هنا تكون موجودة. The same is present in the interosseous membrane middle tibiofibular joint. Other type of fibrous joint, I have the gomphosis. من أقول كلمة gomphosis مثل السوتشر. الوحيد بالجسم الgomphosis هو I'm talking about the tooth. نقطة التقاء الtooth مع الفك with the jaw, whether the upper or lower jaw, the mandible. It is like a peg sitting inside a socket. So the joint is of fibrous type, no cavity in between, fibrous connective tissue connecting it, and the functional classification of it is synarthrosis. It allows no movement. That was about the fibrous joint. We will talk about the cartilaginous. The cartilaginous, we said also it has no cavity. It is of two types. من تجين تقسمين الكارتلاجينس بالجسم عندك نوعين. Number one is called synchondrosis. Number two is called symphysis. Synchondrosis, for example, in the body, is لقاء the first rib with the sternum. العظم القص الأضلاع تجي تلتقي بيها من الضلع الأول إلى الضلع السابع. أوكي؟ من تجين على هذه الأضلاع الموجودة، من هسه أنطيك هذه المعلومة. The first rib with the sternum is of cartilaginous joint type. It is synarthrosis, allows no movement. While from 2 to 7, it is of synovial type. It has a cavity and a synovial fluid inside, and it is of diarthrosis type, functional classification. ليش هذا الشيء موجود؟ الله سبحانه وتعالى خالقه، كل شيء بجسمنا مخلوق لحكمة. The first rib is to يثبت الكيج، يثبت الثوراسيك كيج، فلازم يكون شوية قوي. لكن we have from 2nd to 7th it to allow the free movement during respiration. We all know that we breathe, inspiration and expiration. There is inhalation and increase in the thoracic cage diameter. So to allow the free movement easy also during breathing, we need to have synovial joints. فنقطة التقاء الأضلاع الثاني للسابع بالستernum is of synovial type diarthrosis, while the first to the sternum is of synchondrosis, cartilaginous, and synarthrosis functional classification. هذه وضحناها. The second type of cartilaginous joint is called symphysis, as I mentioned. عم أنطيك غشوشة مال امتحان. كل الجوينتس مال السيمفيسيس are present in the midline of the body. A joint موجود بالmidline of the body is of symphysis type, symphysis cartilaginous type. نيجي ابدي بالسكال، باعي على الماندبل، روحي على مكان اسمه symphysis menti اللي هو يعني developmentally the mandible هو a single bone، لكن during development it formed by two osseous parts and then يلتحم مع بعض، فممكن إنه يترك خط بالنص مال mental region، يعني منطقة المنتي مال الماندبل، ف it is called symphysis menti. نزلي لي جوا عظم القص، نقطة التقاء الجزء العلوي من عظم القص المانيبرم بالبودي يسموه مانيبرم sternal joint. This is of symphysis type. نقطة التقاء الفقرات مع بعض، هذا intervertebral joints is of symphysis type. عظم الحوض the pelvis consists of two bones, two hip bones. نقطة التقائهم at the midline anteriorly is of symphysis, يسمى pubic symphysis joint. These were examples about symphysis. When you come to the functional classification of the symphysis, it is of amphiarthrosis. It allows slight movement. Now we will come to the synovial joint, the hero of the joints in our body. As I mentioned, most of our joints are of synovial type. When we come to describe it, من أجي أنا هسه أريد أشرحها. You have two bones meeting together. Each end of the bone, as I mentioned, this is the epiphyseal part, هذا epiphysis, is covered by an articular cartilage. لازم مغطى بالهيالين cartilage اللي هو القرقطة. فالتقاء العظمين, each bone has articular cartilage. Also, it is covered by a tissue, fibrous tissue, which is called the capsule. The capsule of the joint, and there is a cavity inside called the synovial cavity. The capsule of the joint has two layers. The outer layer, which is the fibrous, tough layer, it is for attachment of the ligaments and serve for connection of the two bones, شغله إنه يربط. وأيضاً الليجامنتس تجي همينة attached to it, while the inner layer is the loose layer, and it is called the synovial membrane. يعني هذا هسه capsule, the outer fibrous layer, the inner synovial membrane. The synovial membrane has the ability to secrete few mils of a fluid called the synovial fluid. This synovial fluid is freely bathing inside the synovial cavity, containing mainly of hyaluronic acid. And it is like, it resembles the egg yolk, the egg white albumin, مثل بياض البيض يكون شكله والكونسستنسي مالته، ويتكون من hyaluronic acid، وهو نقدر نقول عليها المادة اللي تزيت المفاصل. It is for lubrication. It is for the smoothness that is allowed while we move the joint. يعني أي حركة نسويها إحنا بالجوينت مالتنا لازم تكون very easy، لازم تكون مفاصلنا مثل ما نقول مزيتة حتى ما نحس بالpain. So sometimes when you don't move، من أنت ما تتحرك، من تيجي رأسا تقوم تتحرك تلاقي بالبداية شوية stiffness. And this stiffness is لأنه synovial fluid becomes gel-like substance. With exercise, with movement, it will become more viscous، يصير أكثر سائل. وطبعا this also depends on the aging process. يعني احنا كل ما يكبرون بالعمر كل ما الساينوفيال فلويد عندهم مثلا تقل، كل ما تتجيم مثل ما نقول مفاصلهم، فلذلك يضطرون ياخذون for example، وخصوصا بالwomen اللي هي above 50 years old، they will take a course of capsules يمتد حتى 6 أشهر تبقى تاخذ هذا العلاج اللي هو كبسولز مال تسميه مال مفاصل، تاخذ يومية كبسولة لمدة 4 إلى 6 أشهر حتى ترجع تتزيت مفاصلها مثل ما نقول. طبعا exercise يلعب إلى دور، الحركة، الويت، gender male and female, the activity، هاي كلها تأثر. So to understand، حتى لا نطلع من الموضوع، to understand the synovial joint, you should know it consists of the epiphysis, articular cartilage, articular capsule, outer fibrous layer, synovial membrane, synovial fluid in the synovial cavity. Also, I have the ligaments are divided into extracapsular ligament and intracapsular ligament. يعني sometimes I have ligaments which are outside the capsule. فيسموها extracapsular ligament, strong وتربط. Also, I have sometimes inside the capsule ممكن يتواجد ligament يسموه intracapsular ligament. This, you will all find it in these slides. This lecture is for you. You don't need to return to a textbook. هذه المحاضرة راح تكون كافية شافية كلش وافية حتى تقدر تسمع التسجيل هذا الموجود وتاخذ رؤوس نقاط، وراح تلقي إنه كل الكلام اللي قلته هو من ضمن السلايدز. و as I said, I'm not a person who reads the slides. I'm against this طريقة. نيجي بالنسبة joints also have to have nerve and blood supply. The blood is for nourishment, to give the nourishment and to take the يعني exchange it with the waste products, and also it has nerve supply. ليش الجوينتس تكون إلها nerve supply؟ عرفنا إنها blood حتى to be nourished. It also have to have nerves in order to control its mobility and prevent further stretching. يعني كل joint إلى limitation of movement. We should not move the joint more than it can tolerate. ما نقدر نحرك مفاصلنا أزيد مما تتحمل. فالبين اللي راح يصدر من أنت تحرك الجوينت، مثلا إذا لحيت عليه زايد لازم يصير عندي شعور بالألم حتى أتوقف ما ألح عليه زايد. فهذه فائدة النيرفز الموجودة to supply the joint in order to prevent overstretching and over tolerance on the joint, to protect it. From where does the joint get its blood and nerve supply؟ من الجيران. منو اللي راح يعبر أي blood supply، أي artery، أي vein، أي nerve يمر ينطي. This is called Hilton's law. أكو عالم اسمه هيلتون قال إنه أي artery يمر ممكن يزود فلان joint، فباي هيلتون's law ما إله اسم يسموه articular branch to the joint from a فلان artery. فأي artery راح يكون قريب ممكن إنه يزود هذا الجوينت، أي nerve راح يكون قريب ممكن إنه يزود هذا الجوينت وفق إلى بالاعتماد على Hilton's law. This is the nerve and the blood supply of the joints. If we come to the synovial joints, اللي هي the majority of the joints in our body, we should know it is divided into types. عند أشكال. These types are planar, hinge, pivot, condyloid, saddle, ball and socket joints. مقسمة إلى هذه الست أنواع. ما يجوز بسنيل راح تلقي فد شيء اسمه إليبسويد عندي هو نفس الكونديلويد. اقرأ على هاي المحاضرة تكون كافية. احفظهن planar, hinge, pivot, condyloid, saddle and ball and socket. To understand what I'm talking about نيجي وصف سريع جدا للي موجود اللي هو ما معنى planar. The planar joints, I mean that the two articular surfaces of the bones are of plane surfaces. تكون مسطحة. So the allow of movement is a gliding movement مثل moving anterior and backward, side to side, but slightly. مو يعني بطريقة كلش كبيرة. يعني there is a limitation. gliding يسموه. For example, I have the intercarpal joint. أنا حاطت لك هنا أمثلة هواية تقدر تقراها لازم تتعرف عليها لأنه بالعملي أسألك يجي يعني أشر على joint وأقول give me the type of joint. فأنت لازم تعرف هذا planar joint. Articular surfaces are plane in surfaces and it allows a gliding movement. The other type is the hinge joint. Hinge joints بالضبط is like the يدة الباب. يعني شلون تفتح أنت يدة الباب؟ It's this movement اللي هو for example the knee, elbow and the ankle. It is where the two articular surfaces, one of them is convex, sitting in a concave surface. This is called the hinge joint. The كلش famous exam is the elbow, the knee, and the ankle joint. طبعاً interphalangeal joints also is another example. Other type is the pivot joint. The pivot joint اللي هو محوري. Usually it is like one part, as you see, is surrounded by the other one, allowing it to become يعني longitudinal axis. For example, I have the joint between the atlas and the axis. الأطلس هي الفقرة الأولى والأكسس هي الفقرة الثانية العنقية. الأطلس والأكسس. الأطلس والأكسس تقعد بهالطريقة بالضبط. هذا يعتبر كأنما البر الأطلس وهذا الجو هو الأكسس and it will allow the no movement. من تقولون من تحجون يعني نحرك راسنا يمين نسوي حركة no movement هي هاي حركة البايفوت joint. The other type is the condyloid joint مثل ما قلت سنيل يذكرها كellipsoid type اللي هي one of the surfaces is convex while the other also is convex. The best example is the metacarpophalangeal joint من 2 إلى 5 يعني تستثنى الإبهام. الإبهام ما يعتبر condyloid. من 2 إلى 5 تعتبر condyloid type of joint. The other type is the saddle. هذا للإبهام. من تجي to the thumb with the trapezium, the type of joint is saddle shape. It is like بالضبط مثل هذا المقعد اللي يحطوه على الحصان يعني اللي يحطوه حتى يكون بهالشكل هذا saddle type. It is the thumb with the trapezium. When you come to the ball and socket type, I mean one of the articular surfaces is like a ball and the other is a cup shape occupying it. Two important joints is the shoulder and the hip joint. And this allows free mobility. يعني هذه البول and socket تكون موجودة حتى to allow movements in many directions. That was the types of the synovial joints. If we come to the movements, what are the movements that are allowed to be done by the synovial joints which are diarthrosis يعني مثل ما قلنا حركة عندها كلش واسعة. They come also to يقسمون الحركات الموجودة همين تقرأها فقط هنا gliding, angular rotation and special movements. The gliding مثل ما قلت surface on surface before and backwards, side to side, very limited in movement. The angular, I mean that there is movement in an angle. اللي هي flexion وعكسها extension, abduction عكسها adduction. Circumduction is a collection of these movements together. We all know the anatomical position. When you move, for example, the part to decrease the angle, it becomes a flexion. When you return it to its position, it is extension. When you further move it away from its position, it is called hyperextension. When you decrease the angle, it is called flexion. When you return it to normal, it is called extension. When you further move the joint, it is hyperextension. هذه كلها flexion and extension movements. We do it a lot. Lateral flexion is a term usually applied to the trunk. يعني شلون انت واقف وتحرك جسمك يمين يعني تعقشه بالضبط هيجي الى اليمنى والى اليسرى. This is you move your waist يعني to the left and the right. This is called the lateral flexion. When you move the limb away from the midline, it is called abduction. When you move it near or return it back to the midline, it is called adduction. Also, I have, if you talk about abduction and adduction to the fingers, usually the line, هنا ما عندي midline, but the line is through the middle finger. So when you spread your fingers away from the middle finger, it is called abduction. When you return it back to stick it together, it is called adduction. Circumduction is a sequence of movements. It is usually done in the shoulder joint, which allows the free movement. من تجين عليها أريدك تحفظيها بالتسلسل. من أسألك شنو circumduction تقولين it's an angular movement and it is a continuous sequence of flexion, abduction, extension and adduction. يعني أنت بالبداية سويتي flexion to the arm، بعدين سويتي له abduction بعدتي من الميدلاين، بعدين رجعتي extension وقربتي من الميدلاين adduction. This is moving the arm in a circle around the shoulder joint. The rotation is, for example, I have medial rotation, moving of the limb towards inside, lateral rotation is towards the outside. There are several special movements also present at specific joints. For example, I have elevation, عكسها depression, protraction, عكسها retraction, inversion and eversion, dorsiflexion, plantar flexion, supination, pronation, and opposition. باوعوها على الصور هواية أحسن. For example, I have when you open your jaw, it is called depression. When you return it back, it is called elevation. When you protrude your mandible, لما تطلعوه إلى الخارج يسمى protraction. عكسها رجعتوه يسمى retraction. نفس الشيء هذه الحركة تقال على الكتف. When you come to the shoulders and bring them together to the inside, it is called protraction. When you return it backward, it is called retraction. كلمة inversion and eversion are the special movements that are applied only to the sole of the foot. يعني ما عندي أي مكان آخر بالجسم يسوي inversion and eversion عدا sole of the foot. When you move your foot to the inside by this movement, it is called inversion of the foot. When you move it to the outside by this movement, it is called eversion of the foot. هذه طبعا شوية مهمة كلينيكالي. يعني sometimes when بنية لابسة كعب عالي تمشي رأسا على غفلة التوت رجلها صار عندها حركة inversion or eversion. There are strong ligaments here that will cause a sprain and strain to the foot, causing pain. Other special movement also applied only to the sole of the foot. One is called dorsiflexion and the other is a plantar flexion. The plantar flexion اللي هي this movement where you stand on your toes. For example, Michael Jackson كان يسوي plantar flexion هواية. While when you stand on your heels, it is called dorsiflexion. The dorsiflexion. I have two important movements which is called supination and pronation. This movement is very important in the upper limb, in which we apply a lot of activities through it, and it is done in the forearm, especially in the radio-ulnar joints. They will allow the movement of supination and pronation. To not forget these movements, how it is applied. When there is a quote, English quote, that says, the kings pronate, the beggars supinate. The kings pronate يعني الملوك عادة ينطون إيديهم حتى تبوسها. فالطريقة اللي ينطون بيها إيديهم, their dorsum of the hand is facing upward, while the palm of the hand is facing downward. من تطي إيدك تقول بوس إيدي مثلا هيجي. هذه الملوك. it is called pronation. While the beggars, المجدي عادة من يطلب يسأل دائما تكون the palm of his the palm is facing superiorly, the dorsum is facing inferiorly, so it is called the beggars supinate. حتى ما تنسى هذه movement. Opposition is a special movement applied only to the thumb. فقط الثumb يقدر يسوي opposition movement, which means that by your thumb you can touch the tip of your fingers. يعني especially the little finger. When you apply it to the little finger, this movement is called opposition. I will give you a homework, which is name the movements that the thumb can do. أريدك تحط لي لستة من الموفمنتس اللي الثumb can apply. باوع على الجوينت مال الثumb وتسطر لي الموفمنتس that are مو بس special movements، يعني تقدر تسطر لي الموفمنتس اللي الثumb. ليش أنا مهتمة بيه؟ لأنه look at your hand. If you stop the thumb مثلا by casting، إذا جبست أنت الثumb مالتك إيدك كلها تنشل، كلها توقف يعني.